A special welcome to our colleagues who are online. An extra special welcome to our colleagues who got dressed up and came from very long distances. We really appreciate your being here. My name is Devaki, and I work with many of the other people here at the George Institute for Global Health. I'm delighted to welcome our participants in this live, but also online hybrid event that's focused on acting on health. This is a little bit of a vexed and difficult time. But if you really break it down, the situation in the world has been heartbreaking for a while. And as I said a little earlier to some of you, the work of this convening on social participation for health and on hope, we're trying to have some of us, with some of our ideas, find strength in each other, solidarity in each other's presence, and connections across the oceans. Some of this finds resonance and validity in the 77th World Health Assembly resolution that was passed in May of 2024. And of course, that was a belated recognition of the power of community, of connections and solidarity, which we're trying to celebrate today. But it was a milestone in that, for one of the first times, member states recognized community action for health, the time when communities come together, develop solutions for their health and recognition of their rights, and can really change the face of society. Now, that's a difficult thing to pull off, and it's an even harder thing to sustain. We're at this historical moment where the threats are many, but the desire also looms large for us to try to build a path to honor the World Health Assembly resolution and each other's work and the legacy that that carries forward. Today is a mingling of some themes connected to that idea. So you will see on the one hand our desire to discuss digital solutions and to look at the role of digital inclusivity in building those solidarities and connections. You will also see but an additional and important focus on inclusion. Sometimes these things fight with each other, sometimes they are braided with each other. So our hope is that we can have a bit of a nuanced conversation from the perspective of our many friends across the world who look at this in different ways and see what we can learn. Much of the work that gets reflected on today is before us. So I invite you to engage, ask questions, and stick around and be with us as we go on this journey on social participation for health. Now, with deep thanks to our master ceremonies for all her hard work in a completely different time zone from every single one of us. I'm very proud and humbled to welcome Nina to take over the proceedings today. Hearty welcome to all of you online and here today.
Thank you so much, Devaki. Can everyone hear me? Thank you so much, Devaki. And I'm just here briefly because I'm honored to introduce Nadir, our first speaker, who will give us a presentation on the use of digital tools in Argentina. Nadir is the lead of the trans team within the community engagement area of the Implementation Research Division at Fundación Huésped. Nadir, over to you. Yeah.
Hi, I am Paloma Loretti. Hi. Sorry. Hi, my name is Paloma Loretti. I work at Fundación Huésped and I'll be translating for Nadir.
Bueno, buenas tardes a todos. Muchas gracias por estar acá. Mi nombre es Nadir Cardoso. Soy miembro del equipo de participación comunitaria y responsable del equipo trans de Fundación Huésped dentro del área de investigación y de implementación.
So she says thank you for the invitation. Her name is Nadir Cardoso. She's a translator of the community engagement team at the Implementation Research Division at Fundación Huésped.
Bueno, para darle un pantallazo, contarles que Fundación Huésped es desde el año 1989, es líder en el acceso a la salud pública, trabaja sobre 3 pilares, que es ciencia, prevención y derechos.
1989. And we work with 3 pillars, which are prevention, science, and rights.
En su misión, la salud pública, sobre todo la salud sexual y reproductiva.
Our mission is to ensure equitable access to care and mitigate the impact of diseases while championing sexual and reproductive health.
Y sobre todo el mitigar lo que causan las enfermedades como el VIH, el SIDA, la hepatitis, la tuberculosis y todas las enfermedades prevenibles por vacunas.
And she highlights the mitigation of the impact of diseases like HIV/AIDS, viral hepatitis, and vaccine-preventable diseases.
Abogamos por una sociedad libre de estigma y discriminación con un verdadero acceso a la salud.
And we advocate for a society free from stigma, where evidence-based public policies guarantee dignity and health.
Y en este proceso, con la inclusión de la población trans, Fundación Huésped lleva más de 20 años trabajando con la comunidad trans.
And within this process, Fundación Huésped has been working with the trans community for more than 20 years.
Acá les cuento como una línea de tiempo. Fundación Huésped empezó a trabajar en el año 2010 con el índice de estigma y discriminación. En el año 2012 se sancionó la ley de identidad de género, donde se nos reconoce a nosotros como sujetos de derecho, y esto hace que nos empoderemos y nos empecemos a involucrar en todo lo que es el empoderamiento en cuanto al acceso a nuestros derechos.
So as you can see here in this timeline, we started working in 2010 with the index of stigma and discrimination, and then on 2012 the gender identity law was sanctioned, and it helped empower and involve the trans community.
Desde el año 2015 somos incorporadas, mi incorporación a Fundación Huésped, como el trabajo comunitario, como incluir a la comunidad, de esto algo que ya se venía pidiendo a la comunidad para poder llevar adelante todo lo que sean investigaciones.
She says that she has been working at Fundación Huésped since 2015. Sorry. Which had been a demand for the trans community to participate in research.
Ustedes podrán ver desde el año 2015 en adelante, llevamos más de 30 estudios de investigación.
Trans community has participated in over 30 studies.
En el momento que uno de los principales recursos es la incorporación de peer navigators, de promotores de salud y derechos humanos de la misma comunidad.
So one of the most important things is the creation of peer navigators as health and rights promoters who belong to the community.
Funcionamos como un nexo, o sea, entre la comunidad y lo que es la institución, o sea, llevando de un lado al otro el vaivén de todo lo que es la comunicación. Es súper importante porque la institución se nutre de todo nuestro conocimiento, de toda nuestra experiencia, y a su vez nosotros volvemos a nuestra comunidad y le contamos la importancia de llevar investigaciones adelante para obtener datos basados en evidencia científica que nos permitan exigir políticas públicas. Sorry.
So the peer navigators work as a bridge between the community and the institution and the health system, and they help nurture the organization with their experience, and they can also bring that experience and that data and that evidence-based research and information back to the community. So they are in charge of
Primero nos tenemos que capacitar nosotros en toda la educación para poder volver a nuestra comunidad y poder contarles lo que son, por qué es el objetivo de los estudios, qué es lo que queremos demostrar y el aporte a la ciencia. Después que les contamos eso, hacemos el reclutamiento a los diversos estudios de investigación y no solamente eso, debemos trabajar en la retención de los estudios.
So she says that first they need to learn and to get back to the community about the importance of this information it is for science and the reports that it can make for science, and then they work on recruitment and detention for studies.
Entre el año 2012 al 2026, más de 3.000 personas trans han participado de los diferentes estudios de investigación que llevamos adelante. Contamos con una corte trans de 500 personas trans que están en seguimiento ya más de 5 años. O sea, el proyecto original íbamos a estar en 5 años, cada 6 meses íbamos a la fundación donde se brindaba atención médica y también se hacía una entrevista psicosocial para ver la situación de la comunidad.
So from 2012 to 2026, more than 3,000 trans people have participated in over 30 clinical and social studies. And we have a cohort of more than 500 trans people who are being followed in this cohort that has been going on for 5 years. And they go to interviews and to medical checkups and psychological checkups for 6 months. Within a 6 months period.
También es importante el crecimiento para la institución. Nosotros podemos estar como peer navigator dentro de la institución, pero si todo el equipo, si todo el sitio, la fundación, el equipo de salud no funciona, nada va a funcionar. Yo puedo estar en la puerta y decirle a todas mis compañeras ingresen, pero si sufren estigma, discriminación de cualquier parte, de recepción, enfermería, parte de médico, parte administrativa, no van a volver. Es importante el trabajo en conjunto, por eso logramos estos números.
And she says that it is important for all the institutions to work together for this, because you can say the peer navigators can be in the door of the institution, but if the reception and each step doesn't know about this, it doesn't work. So everyone has to work together.
También tenemos sobre todo nuestro medio de comunicación usando las redes sociales, las plataformas, es fundamental para la comunicación entre la comunidad.
So social media and platforms are fundamental for communication with the community.
Por eso usamos mucho el sistema de WhatsApp. Es algo que la comunidad ya conoce, ya es de uso cotidiano. Esto nos permite acompañar y llevar toda la información necesaria de una forma clara, sencilla y comprensible.
And that's why we use a lot of WhatsApp, because it's accessible and it's familiar for the community, and it allows to bring information in an accessible way and in a common language.
En estos contextos difíciles que nos tocan atravesar, en estos momentos de coyunturas políticas donde la derecha está en el gobierno, esta es nuestra forma de comunicarnos, de sostenernos y de seguir defendiendo todo lo que hemos conquistado y seguir avanzando.
And in this difficult context with right-wing political context where the community is being threatened, these digital tools helps to sustain and to build on advocacy and empowerment, and defend the rights of the community.
Es sumamente importante la investigación participativa, donde la comunidad esté inserta en las investigaciones, desde el pensar, la lluvia de ideas, desde la planificación, la implementación, seguimiento, el monitoreo, después la evaluación y después con eso hacer abogacía para exigir políticas públicas.
And participatory research is crucial and fundamental for the community, and to be present at all the stages of the research, in the design, in the implementation, in the follow-up, in the monitoring, in the evaluation, and then in the advocacy to demand for public policies.
También algo muy interesante para nosotros es que somos reconocidas y formamos parte como investigadores pares en todo lo que sea las investigaciones. O sea, estamos como autores de las diferentes abstracts, papers que se presentan. no solamente se nos convoca para ser parte, sino que se nos visibiliza como parte también de investigadores pares.
And another thing that is really important is the integration and the recognition of the community as peer research associates. So they are not only called for investigation, but also being authors of that papers and publications.
Y para ir finalizando, también contarles que hemos adquirido una buena práctica en este último año y medio, 2 años, de integrar a la comunidad como parte de los comités asesor de base comunitaria, ya no solamente en el rol de navegadores pares, sino que ahora también desde nuestro rol de adentro convocamos a diferentes compañeras trans a que también se sumen para tener otra mirada.
So a good practice that we've been working on and we've been implementing is the creation of community advisory boards. So not only we have the community as peer navigators, but also including them in Anders' perspective from the beginning.
Bueno, y para finalizar, agradecer al Instituto George Institute, al proyecto EFIR, el estar acá, porque es sumamente importante. Por más que tenga la limitación de mi idioma, que no me puede expresar, que esté limitada, pero es importante que nosotras traigamos nuestras voces y que seamos escuchadas.
So she really thanks the George Institute and the Sphere Project for being here, and she says that even though she doesn't speak English, even though of the language, despite of the language, it is really important for her to be here and to be heard.
Bueno, y agradecer a todos ustedes por habernos escuchado. Muchas gracias.
And thank you all for listening. Thank you.
Thank you. Thank you so much. Thank you, Nadir. Thank you, Paloma, for interpreting for us. We'll do a Q&A after all of the presentations, so we'll move right into the next presentation. I am going to give the floor over to Kim. Kim is the Deputy Director of Programs at the Center for Supporting Community Development Initiatives. She is joining us remotely today, so we will bring her onto the screen now along with her slides.
Thank you, Nina. So good afternoon, everyone. I am Kim. I'm the Deputy Director of SCDI, and today it is a great honor for me to participate to share our experience in leveraging digital tools to support and empower community. Next, please. So our philosophy is simple. Digital tools are the means, but inclusion is the goal. So technology is only as effective as the human support behind it, and our priority is always to empower the most vulnerable voice in our health system. Next, please. Resources constraints have been a significant challenge for us recently and also at the global level. With limited budget, optimizing our spending became an immediate necessity. Traditional training and meeting model becomes a luxury. We could not no longer afford due to the high cost of travel, venue, and complex logistics. Moreover, the expensive model often fail to address the deeply varying needs within our community. So to remain inclusive while being financially responsible, we have to find a radically more efficient and adaptive approach to bridge this gap. Next, please. These challenges highlighted the need for a suitable and scalable scalable solution, and our answer was Zalo. We choose this application because it meets the community where they already are, And in Vietnam, Zalo is deeply embedded in daily life, reaching even the most remote mountainous area. It requires only a basic smartphone and allows for the sharing of image, voice message, and survey form without any technical intimidation for the user. Next, please. So the shift to Zalo fundamentally changed our operational march. By moving online, we eradicated travel and venue costs, as well as the accommodation burden for our participants. The system operates on low-cost data plan and offer total flexibility, so people can review the content whenever they are free, removing the time pressure of live classes or meetings. Next, please. In our pilot phase, we use Zalo primarily for broad community group by pairing Zalo native feature like poll and surveys with external tools like the Google Form or video links. We create a truly interactive and scalable learning and sharing environment among the community people. Next, please. Engagement isn't just about sharing information, sending information. It's about building a habit. So we maintain daily interaction for the first 2 months before tapering for a sustainable rhythm of 2 to 3 times per week. And we also integrated mini games and small reward to spark friendly competition and keep the community active and excited. So you can, as you can see in the slide, this is one of our game in a communication campaign. This is a video, TikTok video, and it is a TikTok communication contest, and this is one of our winner, a member from Dalai province. It is a highland area of Vietnam, and the author is a ethnic minority representative, and he utilized the AI-driven design tools combined with his own knowledge to create this impactful video, and this video received much. It is the most favorite video in the TikTok contest. Next, please. So here are some feedback. The heartwarming feedback from community people. People feel open, feel freedom to join when they have time, and they feel free to raise their voice and share their opinion. Next, please. However, we must be honest about the challenge. A significant digital divide still exists. Many of our members rely on older phones with low memory or unstable internet. Additionally, the digital literacy remains a challenge. Some still struggle to open like the PDF or navigate long videos on their device. Next, please. We also have to manage the constraint of the platform itself. So Zalo is a messaging application, not a specialized learning management system. It lacks features like breakout rooms or automated attendance tracking. So that means our team must invest a high amount of human cost, time, and energy to manually manage and sustain member participation. Next, please. So to overcome these challenges, we focus on hyper-tailored content. We are designing modules that are extremely concise and mapped directly to specific skill level. by dividing larger group into focus subgroup based on their location, their age, their level of knowledge. We can provide more targeted support and adjust our content dynamically based on the weekly feedback and monthly feedback. Next, please. So the true inclusion require a hybrid future. We are working to integrate the accessibility of Zalo with essential in-person activity. So we are also assigning dedicated mentors to provide one-on-one guidance to those who struggle most with the digital format. It's also it's about the tech plus human, not the text instead of human. Next, please. In conclusions, acting together in the digital age means intentionally designing our system so that no one fall through the cracks, and technology is only as effective as the human support behind it, and acting together in the I want to close my presentation with a question for all of us that how can we bridge the gap between digital efficiencies and true inclusion practice within our own network? Thank you. Thank you for your attention.
Thank you so much, Kim, and thank you so much for that question as well. I think we can get to it during our Q&A after our last presentation. This wind is really something else. I come from Chicago, which is the windy city, and this is, almost a competition for that. But last but not least, as our last presentation for this first section, we have Shweta Marathe, who is a researcher at the George Institute for Global Health, India. She is a health systems researcher currently serving here as a consultant, and she previously worked as a senior research officer with Sati, a Pune-based NGO in India. Over to you, Shweta.
Thank you so much, Reena. Thank you so much for the opportunity to be able to part of this panel. And hello, everyone. Very good evening. So, yeah. So we often think about social participation as people participating in some forums or some committees formed by government as part of the governance structure. But today, I want to shift a lens a bit and talk about claim spaces as agitations or protest or community mobilizations as essential form of social participation in health. So I am going to share about some case studies, cases from India where such protests, agitations have taken place as a people's reaction or response to systems non-responsiveness or systems grossly malfunctioning or a complete failure, or in some cases where they wanted to oppose the policy decision taken by government systems. Yeah, so the first case comes from Uttarakhand state, a mountainous hilly state of India closer to Himalaya. So this case began with maternal deaths and denial of care in this hilly region, and these incidents took place in October 2025. So Kuldeep, a person who desperately knocked the doors of doctor at night for emergency care for his wife, who was in very severe pain, and it was just a day after childbirth, and doctor that night refused to provide any care and suggested that he should come next morning when another doctor will come. So at that night itself, his wife died. So as we all know, this is not a rare instance, right? It happens in all corners of India. It happens in aspirational state, it happens in Maharashtra, it happens in Rajasthan also. So in many parts of India, such instances do keep happening. and at most of the times, at the most it comes in media, it gets covered by media. Sometimes a little noise is made around it, but in this case in Uttarakhand, people did not just kept silence or kept mourning, but they all came together. They protested against the systems. They made some demands against chronic shortages of doctor or and healthcare facility shortages in Uttarakhand. So in response to that, fortunately government responded, and government also announced upgrading that CHC, Community Health Center, to 50-bed sub-district hospital. But nothing happened for a while, and then people decided to continue that protest. And people not just protested just being in that part, but they marched 300 kilometers from Chaukatia, a small village where this instance took place, to the Uttarakhand Assembly, which is based in Dehradun. Thousands of people participated in the protest, including women, elderly people, also children, and their demands were not just related to that one hospital, but they were demanding for overall improvement in the health facilities in Uttarakhand. So when Protestants actually reached the assembly in Dehradun, chief minister made some serious promises to them, and only then Protestants went back. So the other case is from Bijapur block of Karnataka state, which is a state from southern part of India. Here the protest was about privatization of district hospital under the PPP model. So students, doctors, unions, Dalit group, all of them came together and protested against this move. And movement was spreaded across many parts of the state. The protest lasted for 115 days, and it became one of the longest protests of public health agitation in the state so far. And as a response to this protest, instead of making some positive decisions, police actually filed FIRs and arrested 22 activists. So activists were arrested with the false allegations like conspiracy against nation and things like that. But despite this arrest and FIRs, mobilization continued. Protest did not take any back. Eventually, government had to take respond to the mobilization, had to revoke the decision, and the decision of privatization was taken back. So this can definitely be treated as a successful, impact of the mobilization that took place here. There are two other examples, one from Mumbai, Maharashtra, and another is from Gujarat. So in both places, mobilizations, protests took place again against the move of privatization. So in Mumbai, people from informal urban settlements came together against the same issue. And in Gujarat also, sorry. Oh. Yeah. And in Gujarat also, similar protests were made. Mainly tribal community women were participated in both these cases. In Mumbai, officials did not even show up. So response was very poor from government side. But in Gujarat, at least privatization decision was slowed down. So there was some response from the government end. So if we look at all these cases, so all these cases took place in last 6 months, and I think that speaks a volume about public health system and health policies in India. So if we try to understand, analyze all these cases as claim spaces comparing with the invited spaces, we can see that in mobilization, health service issues are framed as public good and state's responsibility. While as we know in invited spaces, members just have to act within those structured spaces and given within the structured format. Also, in protest, agitation, mobilizations, issues those were taken up were not just about implementation level issues linked with service delivery. They were mostly about policy level, systemic or structural issues like the move of PPP or privatization, or also, chronic issues or overall neglect of public health infrastructure. So, which are probably not in the purview of invited spaces, or probably invited spaces are not so enabling to raise and make such demands. In protest, as we know, participation expanded beyond much formal representation, and it was much more inclusive. Like elderly people participated, tribal, Dalit, women, all these groups could participate quite widely. So this is another striking part that we can see, the inclusiveness of the claim spaces. Protests act as countervailing power. They give much more visibility to the public health issues otherwise which is not on the political agenda. Persistent efforts were made in all those cases. Like none of that was like 1 hour or 1 day demonstration, people came together and went off, but all of those efforts were quite persistent. So people were struggling for 115 days, people sitting in the a hospital, in front of hospital for 60 days. So persistent efforts were made, so probably that forced system to respond to their demands. So all these differences we can see when we compare this efforts against the invited spaces. So it can be altogether said that while invited spaces do offer mandated space, it do offer institutional access to the community members. If those spaces are just tokenistic, if those are just acting symbolic, then definitely claim spaces are much needed. They play a critical role, not just in giving wake-up call to system, but also amplifying voices and pushing the system to listen to people's voices and change. So I'll conclude by emphasizing the need for documenting claim spaces, all such efforts of community mobilization, different forms of social action, protest, agitations that take place in the response to non-responsiveness or malfunctioning of the system. So as an important form of social participation in health, we need to document these efforts in much more detail to understand who initiate actually these initiatives. Also, what are the moral forces that bring people together and how resources are mobilized. Otherwise we even in a project mode struggle so much for resources. So how in these cases in voluntary efforts these resources are mobilized. So definitely looking at these efforts in detailed manner will help us understand what processes, what outcomes or what impacts are there of the contentious kind of participation in the health reforms. And definitely I think this documentation is essential in advancing the SPH agenda further by generating more and more evidence around it and more in-depth analysis around it. I'll stop here. Thank you so much for the attention. I wanted to display acknowledgements. No.
Thank you so much. I want to bring Kim back on the screen for our Q&A. Thank you, Nadir, for your presentation and Kim as well on outlining the use of social media, the use of messaging tools, and bridging that gap between bridging that gap in social participation for health. And thank you, Shweta, for talking about the different forms of social participation for health and what meaningful engagement really looks like and how complicated this space really is. With that, I invite everyone in the room to raise your hand if you have a question for our speakers and on the presentations. And I invite everyone online to please submit your questions in the Q&A. I just ask that when we have any questions from the floor or online, you please start by saying your name and introducing yourself with your name. And if you want to include your organization or anything else, and then please say your question. Ria has a microphone. Thank you.
Hello, everyone. My name is Devaki. I work at the John. So there is a lot written actually about the challenges of what we call surveillance capitalism, right? That we are being watched constantly. And there's a problem with that, of making your personal information and your people having access to that. How does one balance the challenges of being able to keep your privacy, or what some people say, the right to opacity, like everything about me is not going to go out there, but at the same time be able to advocate for health? How do we balance those things? And another question is about, when we have, quite often when we've been mobilizing for a long time, And we see this especially after, mobilization for HIV. You claim spaces, they become invited spaces, and then their nature or structure, as you were saying, Shweta, becomes very different, or things kind of change, and there are some challenges with really balancing being able to be at the table or being able to engage constructively with government, and at the same time being political about what you really want to say. I'm wondering from any of the panelists who would like to speak, your reflections on these two ideas.
Thank you. Can I start with Nadir on the first question? Nadir, would you be able to speak a bit to Devki's question around balancing the challenges of privacy and still being able to advocate for health in the digital space?
Hola. Es una pregunta media difícil de responder, pero en este momento creo que es sumamente también importante nuestra visibilidad a través de las herramientas digitales. Y cuando hablamos de herramientas digitales hablamos de Instagram, de Facebook, de TikTok, que muchas veces lo utilizamos desde una parte común de mostrar nuestras vidas para hacer el reflejo para otras personas que se encuentran en un estado de vulnerabilidad, con miedo al estigma, a la discriminación. Entonces es como un espejo, tratar de mostrarle todo. Desgraciadamente en los contextos de ahora hay como muchos discursos de odio, hay mucha violencia. Entonces también nos estamos preparando, por ejemplo, en Argentina, ahora en estos momentos va a haber una capacitación sobre cómo enfrentar la violencia digital, porque también de esta forma como que nos empiezan a callar, a censurar, empezamos como a tener miedo. Entonces hay que prepararse para estos momentos.
So she says it's a difficult question to answer, but now it is important. They said that the trans community visibilize and shows themselves every day, and the digital tools are a part of this, between Instagram and Facebook and TikTok, and sometimes showing that can be sort of a mirror strategy for people who are in a vulnerable situation. But right now, in this context, hate speech is rising. So she says that right now, soon we have a workshop on how to face digital threats and how to prepare and how to work on digital security so as to be prepared for those threats.
Pero también tenemos las buenas prácticas para trabajar en red y seguir contando qué es lo que conseguimos. Por ejemplo, nosotros hicimos un curso que llegamos a no los activistas de primera línea, sino de segunda, tercera línea, mediante un curso sobre incidencia política y cómo bregar por la cobertura universal de la salud, cómo acceder a la misma.
But we also have to focus on good practices and a network working, and so that we can explain what we have and how we got this far. So that's when we did our course, we tried to reach activists, not only reference, but also activists in general, for them to advocate for UHC.
Y hoy tenemos, presente esta llegada por medio del WhatsApp, que podemos llegar, en nuestro caso, a todo el territorio de la Argentina, ¿no? No solamente centrada en las grandes ciudades, sino llegar a todas las ciudades, pueblos, a los lugares más remotos.
And that's why we try to reach people through WhatsApp, because it's available and it's used throughout the whole country, throughout all Argentina, not only big cities, but also rural areas.
Perfect. Thank you. No, I think that's really interesting. Also kind of related to the conversations we were having earlier today around, there's room for opportunity, and this connection is really important. And, obviously building alliance, but also just connection for building community. But then at other situations, there's that is also opportunity for risk and in this situation, danger. So balancing that is just something that's so important and volatile as well. Kim, I want to turn to you to ask Devaki's first question as well on how SCDI balanced the challenges of privacy in the Zalo app, and also the way that you all use TikTok, but then also still being able to advocate for health, especially in the Vietnamese context.
Yeah, thank you, Devaki and Nina. So Zalo is a messaging application. So we use that app for the sharing information and idea expression only. We didn't use it as a personal record platform, and we utilize the encrypted external tool like Red Card and or Google Form or organize in-person consultation to protect the privacy of the community people. So yeah, it's just like the eye-breaking platform, eye-breaking mechanism for the people to share their opinion and also provide some initial information. Yeah. So that's the way we balance to ensure the privacies of the community people.
Mm-hmm.
Thank you.
Thank you, Kim. Yeah, I would just like to respond to the claim spaces. Invited spaces getting claim spaces getting converted into invited ones. So I think in a way this is positive in terms of getting institutional space access and also mandates. But I think this move would be double-edged, because it may weaken ideology of those movements or the group which are into those protest and agitation, and eventually it might weaken their spirit and also the force of that movement. So in a way, these moves, may not be sustainable, may not be good for sustaining the spirit of those movement, I believe. And it might lead to emerging different level of dynamics between some CSO representative and the government official. So that could be a likelihood as well. And eventually, I believe those committees, if at all, claim spaces are converted into some form of committee or board or forums, those could get eatless kind of thing. So that could also be a possibility. Thank you. Thank you. Thank you, Shweta. Oh, yes.
También quiero contarles una buena práctica, por ejemplo, del uso de herramientas digitales. Durante la época del COVID, cuando tuvimos en aislamiento social preventivo obligatorio.
So she wants to talk about a good practice on the use of digital platforms that they implemented in the COVID, in the pandemic.
Y tuvimos que reinventarnos rápido. Hicimos, por ejemplo, como un magazine que se llamaba Juntes en Aislamiento, y lo compartíamos con todas aquellas personas trans que estaban aisladas y que estaban solas. Entonces la forma de hacerlo era como un magazine donde le poníamos un cuento, juegos, reflexiones, poesías, y esto lo compartíamos. Fue nuestra manera, en este caso, de cómo se usan las herramientas digitales también para acompañar durante todo ese momento difícil.
So she tells an experience between that happened in COVID, that she said that they had to reinvent themselves and reinvent fast. So they did a sort of like a magazine, like that was, the name was Get Together in Isolation, like virtually, right? So they included games and poetry and stories, and it was a way for them to be together and to accompany themselves when physical interaction wasn't possible.
Thank you. I think that was lovely to share. So I'm glad that you shared that with the group. And thank you for you. read my question and then answered it pretty much. So that was perfect. So thank you all. We have a question from online. And then we'll come to you on the floor. So from Christina online, she is asking, how did each organization get sustainable funding for the programs to bridge gaps in social participation for inclusion practice? Do you want me to say it slowly? I read it very... Kim, were you able to hear the question?
Yes, the question in the chat box, right?
Yes. So I can give you the floor now. While you think about it, if you're able to answer it, Kim.
Okay. From my opinion is because of the limited funding, so we need to optimize the funding we are having by building the community system and empower them. So we invest in the community people. So by empower them, we can support them to manage by themselves, not only the platform, the community platform, but also the practical movement, the practical participation. Yeah. So we focus on the empowerment of the community.
Thanks, Kim. That's super clear. So really embedding this work within the community and making sure that regardless of the volatility of funding, that their capacity is maintained throughout. Did I capture what you were saying correctly?
Yes, thank you.
Thanks, Kim. And would you like to speak to it as well?
Sí, es medio difícil, pero creo que es el buscar alianzas con diferentes agencias, con diferentes financiamientos, porque para poder llevar todas estas actividades, obviamente que es necesario el presupuesto. Entonces, así como hablábamos primero de hacer un mapeo de actores, bueno, también buscar un mapeo de actores de todas aquellas alianzas donde podemos llevar nuestras necesidades y que nos puedan acompañar. Esa sería como una forma de sustentabilidad. Buscar las alianzas, fortalecerlas.
She says it's difficult. It's a difficult question, but she highlights the importance of creating alliances with agencies and with different funding, because we talked about the importance of mapping before, and she said that mapping of funders is also important to see to who are we going to tell our demands and ask for funding.
Por eso muchas veces hablamos de la importancia de la voz de la comunidad para concientizar, visibilizar y sensibilizar.
So that's why she talks about the importance of the voice of the community to sensibilize, create consciousness, sensibilizar, concientizar.
Concientizar, visibilizar y sensibilizar.
And visibilize.
Perfect. Thank you. And Shweta, I also wanted to ask you, linked to that question, when communities are trying to balance being at the table and then also the risks around being political once they're at the table, how do you think that they can, these communities can maintain some sort of sustainability around funding for their work when they're trying to balance these two?
Yeah, so I think in the first place, we don't know in which cases there is a funding support where financial resources are also involved and in which not. So that's the reason I emphasized on documenting to develop more understanding and analysis around this claim spaces and these efforts. What is bringing them together? What keeps them going? What is the moral spirit behind it? So I think this analysis and this detailing is much needed to unpack all of this. So currently, we do not know, and in all 4 cases which I mentioned, funding was not involved. So that I can talk about.
Perfect. Thank you. We have time for one more question. online. We also have one from the floor. And yeah. Please introduce yourself and then ask your question.
Sure. Hi, I'm Sudha. I am a legal aid lawyer and research fellow. I work with the Center for Justice, Law and Society at OP Jindal Global University. And my question was to Shweta. So I wanted to know why you took up the 4 case studies that you did. What was your selection method like? As well as I wanted to know your thoughts on how protests regarding health have been taking place in the country, because they don't often come to light with regard to healthcare failures directly, but it's also linked to other small issues. For example, the Araku protest, which was regarding the mental health and domestic violence consequences for women in rural Andhra Pradesh, in tribal areas of Andhra Pradesh, because of alcohol abuse by their husband, was also a mental health, was also sort of a health aspect, but that was linked to a larger protest. Similarly, there's been mobilization around the Mental Health Care Act, and the disability movement and the voices of people with mental health within the movement. So I wanted to know how you look at protests regarding health in those circumstances. I also had another question. So we have a lot to learn from protests, yes, but they're also happening in an environment where they're not encouraged. In fact, dissent is quelled quite thoroughly as well. You mentioned activists being arrested on false charges, and looking at how protests are being organized now, especially after what's happened in JNU recently, and the way students were, dragged to the station without any fault of their own. How do you then promote protests as a means of social participation despite such a technicality?
Yeah, so first of all, these are cases, not case studies done by our team or the organization. So these are cases which I came across from 2 sources. One is media reports and second is PHM blog series, Janaswastha Abhiyan's blog series, which has been in place since last 3 months, I suppose. So these were the only 2 sources through which I learned about these cases and I shared about those. So again, I would emphasize go back to the issue of documentation. So not much is being analyzed, not much is being systematically documented or published about these cases. So even if you ask me like some nuances about it, I am probably not the right person to talk about those. So this has been the gap and we have to fill this up. Now about second part of your question, I think yes, protests are not encouraged. Those will never be encouraged because they call disruption to the system. But definitely we have to understand that disruption is necessary. Because in the first place, why protest or agitations? Why people are, gathering, living their, livelihood and things, and they're gathering and sitting there, having those sit outs outside the hospitals? Because something is not working, because something is not functioning, or even responding in the formal framework of invited spaces, right? So as a response to the non-responsiveness of public health system, they have to be organized. So that disruption is necessary for a system to respond. So this is how I would put it out. So yeah, that's all. Yeah.
Thank you. I think we do have to move on to the next section. So I just want to say thank you to all of our presenters, and a special thank you to Kim, who's joined us online. Your presentations were also insightful and the Q&A even more so. So thank you so much. You two are going to stay on stage, but a round of applause also for Shweta and Kim, who are done. And I would like to invite Margaret and Gabriele to join us online. And we can take like a minute if you guys want water or something. Okay, good. And Jamal. We're just waiting to bring our speakers who are online onto the projector here in India. So if you just give us a second to everyone online. Thanks. You guys are so great. Have you guys met before? Okay, just turn off.
Let me just stop my video.
For our panelists online, can you please mute yourself for now? Thank you. Okay, great. There you are. Lovely to see you, Gabriele and Margaret. So this brings us to the second section of this webinar and this public event here in India, which is our fireside chat, where we're going to be discussing lessons learned from developing and implementing digital tools for building advocacy capacity, how these lessons from the Sphere project and documenting social participation for health are relevant in advancing the implementation of the WHA resolution on social participation for health, and then how that can be used in the upcoming SUNWAI work. So before we get started, I want to introduce all of our panelists. We have Nadir here again. Hello. We have Paloma joining us as Paloma, who is a public advocacy analyst at Fundación Westbed. We have Margaret Lubale online, who is the executive director of Henet. We have Jamal Siddiqui, who is co-founder of Trans Men Collective. And we have Gabriele Pastorino, who is a health systems advisor at the World Health Organization, joining us online. So to get us started, I'll start with you, Nadir. Can you talk a bit more about developing the WhatsApp course? So what was your emphasis when you contributed on WhatsApp in the course? And was there anything in that that surprised you in how it worked?
No, creo que nos deja algunas lecciones aprendidas. Que, por ejemplo, la primera es cómo garantizar la conectividad ante poblaciones tan vulnerables, como es el caso de la población trans, que muchas veces no tenemos acceso ni siquiera a la alimentación, a una vivienda digna, a un trabajo formal. ¿Cómo podemos asegurar la conectividad?
I think that she thinks that from the lessons learned, one important thing to think about is how to guarantee connectivity. So for vulnerable populations, so for the trans community, it is difficult to find food and to find housing and to find jobs. So it's even more difficult to find connectivity.
Sin embargo, creemos que es necesario fortalecer los centros de referencia, donde las personas acuden cuando tienen diferentes dificultades. Eso es sumamente importante que ahí que puedan tener este acceso.
However, we think that is fundamental to strengthen places that are centers and references for these people, to them to go where they go when they have difficulties.
Y sobre todo en los grupos de WhatsApp, siempre es necesario, por ejemplo, que estén liderados obviamente por alguien de la comunidad, que pueda traccionar y esta persona tenga toda la formación para poder articular con diferentes organismos, instituciones para dar respuesta.
And regarding the WhatsApp course, it is fundamental for it to be led by a community member, a member of the community, for that person to traction and to have the capacity to then articulate and give answers to the demands.
Y esto es lo que favorece la confianza, el compromiso, el seguimiento de las personas.
Because this is what enables trust and commitment and trust.
Yeah, so really marrying the two of the digital space and then also the physical space, but then building that trust, which is an underlying concept, I mean, throughout every layer and every component of social participation for health. Thank you. And I have a follow-up question for you. So I have a second one for you as well. But how do you think we can tackle these issues of inclusion when we're using digital platforms? So
Bueno.
Oh, can I continue? Yeah, sorry. So for example, using WhatsApp helps, right? But then you mentioned that connectivity issue that still exists. So what has to be thought through to still make these social participation for health platforms even more accessible?
el WhatsApp funciona, pero como dijiste, es un problema de la conectividad, entonces como que se tiene que pensar para que sea más accesible.
Es una pregunta como que está muy buena, pero bueno, no solamente tenemos que pensar, como te digo, en la conectividad, es un gran desafío. Si todavía no tenemos respuesta en cuanto a una pregunta en cómo acceder a un trabajo, a una vivienda, entonces también se dificulta cómo pensar en acceder a la conectividad. Por eso digo que es necesario fortalecer las organizaciones, los lugares de referencia para que las personas cuando acudan ahí pues tengan asegurada la conectividad por este momento, ¿no?
She says that it's a good question, and for people to have connectivity, they have to have other rights guaranteed. So if it doesn't happen, it's more difficult to have connectivity and to get access to connectivity. So that's why it's so fundamental to strengthen organizations and places where people go when they need help, so that when they go, you can guarantee everything, rights and connectivity as well.
Thank you. Paloma, looking over to you now. As the project manager of this great work that's been happening, and having been so involved in the sphere work, looking ahead, if you were to design a capacity building or advocacy course today for another equity seeking group, how would you approach that design process differently based on what you learned from this WhatsApp course?
So talking with Nadir and with the team, which I think is watching, we thought of two main things. One is to seek to reach more people throughout the whole country, throughout Argentina, which Nadir said before, and also to seek for the continuity. So in order to seek more engagement and support of advocacy strategies, we needed to be we need an ongoing support, an ongoing community of practice, and with the challenge that still remains for it to be to prioritize share an accessible language and a familiar tool, because we used WhatsApp because we know that it is what the community uses. But if tomorrow we had another app that we know is used, we would go to that app. So it's an ongoing process that we would update.
Oh, that's super clear. Yeah, so that concept of familiarity and trust it translates exactly into the digital space as much as it exists in the physical space. Fantastic. Thank you.
Thank you.
Margaret, moving on to you online. Can you hear us?
Yes, I can.
Fantastic. And now we can see you. So at the Hennet National Conference in July 2025, we heard about the various online social participation spaces and mechanisms that exist in Kenya. Can you speak about what digital tools are used and how they broaden participation in decision-making processes?
Okay, thank you very much. I think it is true that digitalization is now no longer just about efficiency, but the CSO community is using it a lot to democratize the voice of the community and CSOs in health governance. Some of the ways in which we are using digital tools is by way of virtual town halls, webinars, like when the country rolled out the new social health insurance. We had numerous webinars trying to understand what was different, trying to figure out what people wanted, and making, advocacy demands around the packages. And also in terms of just being able to have a policy dialogue that would bring communities together, county officials and national policymakers. The second thing has been the WhatsApp community groups. Like Hennet runs about 20 WhatsApp community groups. And anytime we are doing anything, we post on these community groups. And these have been very effective in helping us to to know, for instance, stockouts in the country of vaccines for children. And they have helped us to get quickly data from the ground and feedback about, for instance, BCG vaccines that mothers missed when they gave birth, measles vaccines. And so they have helped us to be able to receive real-time information and develop evidence that we can use to feed into the policy discussions, and even media. We do media advocacy, and these WhatsApp community groups help us to identify the right community groupings and right people to bring from the grassroots to go
Margaret,
to the media to talk about the situation. Hello?
Yes, we can hear you. Can you hear us?
I can
No,
hear
you're
you.
still with us.
All right, thank you. So I think finally we've also had dashboards, digital dashboards, and in one county we have a situation where the governor has everything in terms of healthcare. That at a dash you can see how many ambulances are in place, how much money has gone into each facility, how many workers are in each facilities. And so that generates a lot of dialogue with community when people are talking about what's ailing a
Margaret, can you hear us? We lost you. Oh, no. Okay. Yeah, exactly. And connectivity. We'll give her a second to rejoin.
Can you hear me?
Yes, now we can hear you. Maybe if you wanted to keep your camera off for the bandwidth, then we'll be able to hear your remarks. Thank you.
Thank you. Yeah, so I was saying that the use of digital dashboards and open data portals that help to translate complex health data into budget data into accessible formats. And so in this particular county, there has been a lot of transparency because communities are able to come for a town hall, and the county is able to show real time what's on the ground, how much money was made, how many workers are in place. So when communities are complaining this facility doesn't have a worker, the governor is able to click on the dashboard and confirm that the communities are saying the truth. And so that has enabled even the communities to engage with the data and to be able to have a dialogue around, quality health service provision. And of course, that has strengthened the dialogue. I think the biggest asset for us in digital technology has been social media, which has really been used by civil society to run digital campaigns and even to crowdsource public opinion and to mobilize communities around health financing. And the case of HENET, right now we are running a digital campaign around health data as a right. And we are working under the banner of Transform Health, which is a global digital health campaign. And we are moving to mobilize communities to understand that their data is their right, that they can go and ask for their data in the facilities without feeling like they're infringing upon, the rules of an institution. And so we are finding that we are also able to hold discussions around health financing and service delivery, especially around primary health care, to be able to talk about what ails the health system. We have a platform where communities are able to report real time when they go to a facility and don't get, for instance, HIV drugs or TB or condoms. They are able to report real time that this is what happened when I went there, and then the county is then able to follow through to check. And then if they find that indeed it is true, they're able to then redistribute the products or the ARVs. And so we are finding that there's a lot of opportunity for use of digital tools, and the actual interaction in the digital space using these tools is really shifting social participation from just, consultation to continuous engagement, because through digital tools, you are able to sustain a campaign, sustain a discussion. And I remember that in 2024, we actually had a discussion with the president when there was the finance bill that cost the Gen Z riots. There was a meeting with the president on the X space, and that particular meeting had almost 1 million youth, and it's a wonder it did not collapse. But the youth were there and they interrogated the president for almost over 4 hours. He had back and forth with them, and they were so expressive. And so that's something that had never been done before. You getting the president is not easy, but through the X space, the young people were able to get in. And I also went in because I wanted to see what exactly they are talking with the president. And I could see that young people really knew and understood what their health needs are. And the president, of course, made a lot of pledges, and the beauty is that the young people know how to hold you to it. They don't forget. So that really showed the power of the digital space. And so I would say in conclusion that I believe that the use of the digital tools has really lowered very many barriers, like fuel, transportation barriers. You are not known as a community member. How do you get into parliament? But the digital tools have enabled people to just log in and make their voice known. So no cost, limited cost, limited entry barriers, where you have to have a special VIP card to go into State House. That is no longer the case. We have used the space to really amplify marginalized voices, because during our webinars, for instance, we are able to hear from the farthest corners of Kenya and to get very diverse views. Number two, we are able to use the digital space to give feedback. So the feedback loop is getting tighter and tighter, because people don't have to wait for a letter to be written. It is actually real time. If we get feedback, we get on the webinar, we do feedback, we write on the WhatsApp groups, we give the feedback. And so I want to believe that this is even increasing trust among communities, that they can be able to talk and they see action and they see results. And so I think it is really working well. The only thing, of course, is that where you have marginalized communities, digital literacy is something that must be supported. Because without that training, they may not know how to get onto Zoom, how to get onto WhatsApp. Sometimes language is a barrier. And so, helping them to access, translation, and also making sure that whatever is discussed online gets offline at some point and gets to the community that is not able to log in. So I think for us, I would say as Hennet, we have witnessed, digital tools expanding the civic space. People speak without fear of being arrested or fear of being, victimized, and they are able to represent their people, their constituency very well. And so I think it's a space that we are looking to expand and moving forward. And so I think that is what I would say about the digital tools. Thank you very much.
Thank you so much, Margaret. I completely agree around your key points around reducing barriers and then tightening that feedback loop. And I also feel like some key points of what you just said are that some of the benefits of these digital tools are just that speed at which you can receive data in real time and information in real time to then also use that in the social participation for health work, but then also the speed at which you can engage in social participation for health spaces. And also, one thing I wanted to point out is the connection to youth. Of course, that's a critical part of the work in Kenya, but we've also spoken about that with the work at Fundación and the intergenerational component of social participation for health. And we've also spoken about that at SCDI in Vietnam. So that's really something that we see across the countries. And Jamal, coming to you. And also, Margaret, you set me up perfectly for Jamal's question, where this work around you're doing with Transform Health and the fact that the data is people's own data, right? So the Trans Men Collective has focused on community organizing and mobilization through digital means. For example, through its Tamana Fellowship and the MEFU's data initiatives. A key theme emerging from this work has been data privacy, protection of associated rights, and understanding how it affects the daily digital lives of trans-masculine persons. So how has the TMC leveraged digital tools to promote community building, organizing, and capacity strengthening for trans-masculine communities?
Thank you so much for the question, and thank you so much for having me on the panel. And so much knowledge, so much hearing, so much great work. I think for Trans Men Collective, for us also, and for the larger community in the India, people actually are not able to access the physical spaces, and it becomes very important for them to have online spaces where they can exist and just connect with the larger community and have the knowledge exchange. And for us, when we started out, we actually leveraged these Facebook groups, Facebook pages, and Instagram has been like very good with us. And also, we had these WhatsApp group where people connected with us, and that's how we organize people. Apart from that, when the trans law was in up and coming stages, we had these WhatsApp groups where we connected with people also through YouTube channels, Instagram, digital campaigns, where we called out people because the government was calling for suggestions for this trans laws. And then we organized a national meet as well as the regional meetups where we collated all the suggestions of the trans masculine community and then given it to the government. Apart from that, we have a lot of digital. We focus on digital storytelling, which becomes very important. And for us, like we talk about hush topics like sexual and reproductive health rights. We talk about, let's say, digital rights and climate change, of course, and a lot of things that we do in digital storytelling. It becomes a great tool for us to create visibility and as well as for community to participate, and they are very open in sharing their stories where we think that they are not. Apart from that, I think our fellowship, that is Samanna Fellowship, that literally translates to desires, and so it's also about desires of trans-masculine people. So we launched our fellowship in online space as well, and we had these application forms through Google Form as well. We did our interviews on the digital platform Zoom. We connected with a larger community in that. So after the fellowship started implementing, we are doing these peer learning sessions where all the fellows are coming together and sharing their experiences and learning from each other experiences. Apart from that, we also realized that there is a need to have capacity building session in ongoing fellowship as well. So we are doing these leadership sessions, SRHR, and community organizing from national and global perspective. That again is happening on digital tools as well. Then I think our pivot work with Mehfoos data is so it's a digital campaign, online and offline workshops as well. So what we do is that we go to regional communities and community leaders. We talk to them what is their digital needs, what do they would want in the workshop, and then we collaborate on the curriculum aspect of it. Like in Manipur, we talk about the internet shutdowns, and we talked about how they are accessing the internet and connecting with each other. Apart from that, we also talked about that they really wanted to establish online professional identities for them and themselves. So that we talked about LinkedIn and how to use Instagram and create a brand. Apart from that, we when we went to Kerala, people wanted to really talk about this online harassment that is happening in the community, and they want to talk about how they can safeguard themselves from these things. In Delhi, we talk about personal brands, and yeah, that's how we did that. Also, yeah, that's about it. Thank you.
No, that's really clear. I have a few questions for you, but I'll wait. But I have another one, a follow-up question to this. So in your experience, what does digital safety and protection look like when engaging with trans and gender diverse communities within a stigmatized context? And you spoke to that a bit, but to give some more detail.
So I think we need to go beyond cybersecurity and focus every aspect of it, because these data collection through all these digital platforms has become very extractive. And while we were doing these sessions in Mahfouz Data, we talk about digital rights, we talk about DPDP 2023 and 25, and we try to make sure that people are aware of these laws and also their limitations of it. Then we also come up with this session where we give alternatives to all these applications which are actually collecting these data. We realize that because people are not thinking about it, it's just the simplicity of views that people are actually using it. Then there is one session that we do with the community as activists in the community, where we talk about if something happens in next 24 hours, how as a community we are going to respond to it, and we create an action plan, how like legal aspect of it and emotional aspect of it, and if there's need for a collective action. And we also talk about individual actions as well. Yeah.
No, thank you. That's super clear. And yeah, no, that's great. Thank you so much. Gabriella, moving on to you on the screen. So to tie all of these remarks together and bring it up to the global stage, the WHA resolution on social participation for UHC health and well-being outlines what member states and the WHO should do to institutionalize meaningful social participation in health decision-making. So with WHO reporting back to member states on their progress on this resolution this May, and drawing on today's presentations from the inclusion practices in India to the use of social media and messaging platforms for social participation for health in Argentina and Vietnam, and what you've heard from your fellow panelists, what are you looking for from ACPRAC or academic practitioner groups like Sphere and SUNWAI?
Thank you. Good afternoon from Geneva, and thank you for inviting me to this very timely and important discussion. So the first thing I would like to say is that to actually successfully implement the WHO resolution, particularly in the current geopolitical landscape, we increasingly need to work in partnership. And in that sense, I really think that the ACPARC groups are absolutely key. As you all know, the resolution asks countries as well as WHO to institutionalize social participation. And that means making it something regular and meaningful. So it means putting in place durable mechanisms to build capacities, both for the government and civil society to be able to participate. It means allocating dedicated budget, and it means embedding it in legal frameworks. So the key point I want to make today is that really social participation is a core health system governance function. So we cannot look at it as a project or a communication exercise. It's really implementing the resolution means shifting from isolated good practices and pilots to more permanent, resource and safeguarded ways of bringing this community voice directly into the policy making and into health service decision. So in that sense, I think what we heard today in the presentation from India, Argentina, and Vietnam really reinforced this, because what we can see across these very different contexts, this presentation reminded us that when our so-called invited space are weak, communities then create their own spaces. And that's usually a signal that the health system needs to strengthen its participatory arrangement. So what does it mean for ACPRAC groups like Sphere and SUNWAI? For me, this comes down to maybe 3 or 4 very concrete areas where I think you can make a real difference. I think the first one is around codifying and standardizing what works, because it really helps us to turn these approaches into practical, usable playbooks with simple templates for facilitation, for moderation, for safeguarding, so that ministries of health and civil society organizations can understand them, adopt them as a standing mechanism rather than one-off projects. The second area is in the capacity building space. We know that governments need skills to run inclusive processes and being able to analyze the inputs and actually, very importantly, close the feedback loop, which is often a very not addressed issue in this space, and actually provide adequate financial resources to be able to do this work. At the same time, we know that weak civil society is not a good entry point for participatory processes. So we need communities and CSOs that are supported through digital literacy, through advocacy framing, and understanding how effectively they can learn to actually engage and, pass me the word, lobby the system. And this is exactly what the resolution is calling for, is around capacity strengthening across institutions and civil society. Then we have a third area, I think, which is around helping authorities to implement the feedback loops. And I know this is simple, but it's really it's a really transformative rule, because every community recommendation should get a public response within a defined time frame, whether it is adopted, or not adopted, and with what reasons. And that's what is often missing and what really makes participation credible and more governance relevant. And finally, which I'm putting last, but in fact, I maybe should have mentioned it first, is really around the documenting and evaluating. So we are committed as WHO to basically document best practices in this space. And we need the help of different actors, definitely academia, but also civil society working on the ground. So continue helping us to capture what works and what doesn't. And whether in invited space or claimed ones, we need to be able to capture what is happening on the ground so the country can learn, adjust, and stay accountable over time. And as I mentioned before, it is about basically ensuring that those good practices get up at system level and become institutionalized. So these are perhaps the areas where I think aquatic networks can truly help us sustain the implementation of the resolution. And I think it's just in a way the beginning of the journey, because the resolution was approved only a year and a half ago. But I really see this collaboration and this space as a key one, particularly in the capturing the best practices and in the monitoring and evaluation. Thank you.
Thank you so much, Gabriele. And it's super clear what the WHO needs for us. So thank you for outlining that so clearly. For the last section of our panel, I have a speed round planned for everyone. So everyone has 1 minute. And I have my timer here because we are running out of time. So Margaret, I invite you back on the screen. So I'm going to give every panelist 1 minute to answer the following question. And we'll start with you, Paloma, then we'll go to Nadir, then we'll go to you, Jamal, and then we'll go to Margaret, and then to Gabriele. So looking ahead to 2030, the deadline to achieve the Sustainable Development Goals, what is the single most important improvement that you hope to see in how communities and advocates engage in social participation for health efforts?
So we've prepared something so we can to say together. So we think that is really important to create spaces for social participation where they do not exist yet, and to sustain and strengthen where they do. And it is essential to protect what we have, which requires sustained support and strong community networks.
Oh, wow, that was quick. 20 seconds.
We had it prepared.
Over to you, Jamal.
I think it's very important for whatever infrastructure that is created is actually co-owned by the communities that are actually part of it and for their benefits, and the power segregation, and that's what I feel for 2020. Yeah.
Oh, okay.
No, también contar la importancia de las herramientas digitales en el compromiso con la comunidad y también para los que nos sirven.
Can we have the other mic? So she says the importance of with digital tools of the commitment with the community.
Hace 10 años, por ejemplo, en Argentina, la masculinidad trans estaban invisibilizadas y no participaban, por ejemplo, de nuestras encuestas digitales.
So 10 years ago in Argentina, transmasculinities were not visible and they didn't participate in the surveys in Argentina, in Fundación Huésped surveys.
Hace como 4 años trabajamos sobre empoderar a los compañeros de masculinidades trans, sobre la importancia de obtener datos científicos, datos basados en evidencias científicas.
So 4 years ago, we talked with the community of the importance of empowering the community and for them to get data and data based on evidence on their own community.
Hicimos una encuesta sobre el estado y la salud integral y el acceso a la salud en masculinidades trans. En 3 meses llegamos a 415 respuestas con respuestas.
So we did a survey on access to healthcare for transmasculinities and non-binary individuals. And in 3 months, we reached 415 people.
El año pasado hicimos una ampliación de esta encuesta y llegamos en un mes a 587 personas.
So last year, we did a new edition of this survey. And in only 1 month, we reached 586 people.
Y ahora estamos terminando una investigación a nivel Latinoamérica y del Caribe donde participaron 1,000 personas de diferentes países.
And now we are finishing up the new edition, the 3rd edition of the survey, including countries from all Latin America. And we've reached 1,000 answers in 1 month.
Es una buena práctica que demuestra el compromiso, el devolver a la comunidad los resultados para que se empoderen y saber cómo avanzar hacia exigir políticas públicas.
So it is a good practice to give back the information and the data for empowerment and to demand for public policies.
Super clear.
Thank you.
I gave you a little extra time because it's 2 of you. Margaret, over to you.
Okay, I think for me, looking at where we are as a country and our desire for UHC by 2030, and of course, hoping to achieve SDG by 2030, one of the things that comes to mind is that we are meant to leave no one behind. And so that to me means that then meaningful social participation must be the engine that will get us to where we want to go, if indeed UHC is the destination. And so we need to invest in data literacy, we need to invest in digital engagement and institutionalized community platforms, so that our communities can participate as equal partners in advancing universal health coverage. Because we know that when communities help to design and monitor PHC, definitely services will become more responsive, more equitable, and more, and trust will be rebuilt, especially in our country. Trust will be rebuilt, that people will begin to trust the system and trust the government more. So that to me is my 30 seconds. Thank you.
Thank you. And Gabriele.
Yeah, for me, just building on what I said before, I really think by 2030, what I would like to see is meaningful social participation to be institutionalized as part of the more routine functioning of the health system and the governance of the health system in many countries around the globe. And that means having more permanent structure mechanism in place, dedicated financial resources, and a guaranteed policy response to look so the community inputs is really translated into decision. I think in that really the priority is to work together to scale up proven practices so that they become part of this normal functioning of the health system. And I think if we achieve that, then participation will no longer depend only on projects or people, but it will really function as a governance infrastructure, exactly as it is envisaged by the WHO resolution.
Thank you so much. So to try to quickly summarize all of that, over the next 4 years, what we need to do is we need to ensure that anything related to communities is said by communities and the voice is in social participation for health spaces is in the voice of the community, that any data that is collected or any information that is collected should always go back to the community to use in their own advocacy work, in any capacity building they're doing, or any other work that is related to them as a group. And then all of this comes together as a form of institutionalization or embeddedness within UHC and achieving UHC through social participation for health. So with that, we have about 10 minutes for a Q&A. Do I have any questions from the floor for our panelists here in person or online? Yes. Do you want to? Yeah. Yeah.
So this question, there are a couple of them for the previous panel as well. But we have a question now, which is a little bit on the Indian context. But perhaps we could speak to, its applicability in different sort of global contexts that we have. This question is from Anthony, and he's asking that it's more of a comment. In India, there's an invited platform of Rogi Kalyan Samitis, which are catering to patient welfare in a way, but it is a nominal forum for community voices, but health authorities dominate in decision making. This should change, and the meeting should be in a hybrid mode, and online participation should be made available for different actors. Another question which perhaps we could invite our panelists to speak to is that to institutionalize social participation in health systems, especially in LMICs, what exactly are the key barriers that exist?
Yeah. Margaret, could I ask you to come in on that question? And then Jamal, maybe I can turn to you.
Thank you very much. So I think the first barrier really is the fact that we have no way of structured social participation engagement, no policies, and therefore no budgets, because budgets will follow policy. And so that is the biggest barrier that we have. Number two is also the fact that sometimes, given the shrinking civil society space, you may find that there are communities of persons that are not able to express themselves and be able to ask for, demand for rights or information, because they are the space for them is not opened up. And I want to speak specifically around AYSRH, adolescent youth and sexual reproductive health for adolescents and youth. You find that we don't involve the youth or the adolescents because the constitution says that these young people must speak only when they are 18, and so we don't get their voices. We don't hear the voices of the young mothers, the girls in marginalized communities that have been married off early, the girls that are suffering from fistula. We don't hear from them because nobody gives them space, because culture gags them. And so we do have those barriers to social participation. Culture also is a barrier because there are cultures that demand that, girls keep quiet, women don't talk. When men are in their presence, in their presence, they don't talk. And so cultural, religious dimensions are a barrier. The lack of a policy, the lack of a budget is also a serious barrier. And of course, the shrinking civil society space, civic space is a barrier. And the fact that in many of our countries, you cannot talk about, for instance, the LGBTQ community. You cannot, they cannot come up and talk about what they need, because the space is very shrunken. And so, those are some of the barriers that we face in trying to get voices of communities. So we all know communities are not homogeneous. And so sometimes we miss out on the most important voices because of these barriers. Thank you.
Thank you. That's super clear. Jamal, please go ahead.
Alicia, are you eating?
I think one of the very important aspect I think Margaret also mentioned is conditioning and patriarchy, how it works in India. Apart from that, there is for trans community, I've seen there's a lot of power dynamics that happens with doctor and the institutions and the patients, and that needs to be changed. Apart from that, people don't have awareness that there's a social participation kind of word that exists in health system, because it's like in India, don't ask, don't tell is the system, and we are not able to ask the questions that just simple to the doctors about our health needs. And so that is, of course, a barrier. Apart from that, people are scared in trans spaces, the trans health system, people are scared to question because there's very less number of doctors available for trans people to actually provide them services. So they're scared if they will ask questions and they say something against them, that service, they will be shunned from that services. So that is another barrier that is happening. And also there is no grievance mechanism where we can talk about our issues that happens. So that also needs a barrier.
Yeah. Would you like to? Okay. Thank you. Do we have another question? We have some time for about two more. Any questions from the floor? Okay, I have a question for you, Jamal. And also for you guys at Fundación Westbed. So Nadir, during your remarks, you were speaking about the need, or during the presentation, about the need to have a physical organization along with digital tools or spaces for social participation for health. And then having those two kind of work together. And Jamal, in your remarks, you mentioned that a lot of the non-digital aspects around the work you do is to gather information, gather data, and to understand what the community needs. And then you take that to then maybe build a digital tool or see how you can bring that to the digital space. How do you do you see an interaction between these two, or how do you see what you learned today from Fundación about their remarks on having a physical space along with the digital space? And then for you, how did you see, or what's your perspective on that, using the physical space to gather data to then inform a digital space?
No, creo que va. ¿Va? No. Creo que volviendo a una de las preguntas anteriores, como era el tema de cómo conseguir financiamiento, presupuesto para llevar adelante estos proyectos, ¿no? Creo que ahí está el gran desafío, cómo logramos esto para poder replicar los espacios físicos, no solamente en las grandes ciudades, sino en las otras provincias.
She goes back to another question on the importance of how to get funding for these projects so as to replicate those physical spaces, not only the big cities, but also in different provinces.
No solamente el financiamiento físico para los lugares, sino para los activistas, para las personas militantes, porque muchas veces todo eso se hace de vocación, pero también hay necesidades como la alimentación, la vivienda. Hay preguntas difíciles, ¿cómo podemos asegurar la conectividad si no estamos pudiendo asegurar la alimentación, el trabajo, los derechos básicos?
And the importance of thinking about funding, but also funding activists, because she goes back to the question on connectivity, and it's hard to think about connectivity and the right to connectivity and access to connectivity when you have to think about other rights, such as food or housing, that are not guaranteed. Yeah. And I'll add something that I think that for when so many rights are being violated and are not being guaranteed, I think it's at least in Fundación Huésped, it's so important to have that space that you can have, for example, have a team of that gives personalized attention, and they can respond consults and answers, and they can do it both digitally or in person.
Yeah.
So to have both options, but to have that space, that reference space that you can go and you can seek help or advice, or in Fundación Huésped case, it's psychological help or legal advice. So when you can go there, because it's near you or in the city you live or near where you live, it's good, but it's also good to have it. If you live in another province or in another country, you can access you can ask a question via WhatsApp, via Instagram, via whatever. But still, it is important to be able to guarantee that connectivity along with those other ways.
Yeah. And Jamal?
I think it's very crucial to have a physical space because the trust that it brings out in the community and the confidence it gives to the community that the space is theirs, not just somebody else's. And for us, it's something that we've been trying for a very long period of time to bring out people together to have that space. Of course, as they've already mentioned, that there's a funding constraint to all these kind of stuff. And see, the online spaces do give us opportunity to bring out people from all over the India and connect the pan India. But to have a physical space also created trust in the organization, in the collective as well, with the people, and people to come there is also very important for them to know, okay, this is something that exists for their community and this is going to be there. It's just not for them to be there, it's to also knowledge exchange is also very important in these spaces. Yeah, so that's very important to have.
That's super clear. Thank you so much. With that, I want to thank all of our panelists. Thank you so much. You both have been up here for nearly 2 hours, but we have learned so much from you. So thank you. And thank you to our panelists online, Gabriella and Margaret. Thank you so much for joining us. It has meant the world for you both to be here. So I am going to hand the floor over to Juan now. One moment. And Juan is from our SUNWAI advisory group and also the executive director and founder of SCDI in Vietnam. Please come on the stage for the closing remarks and key takeaways from the session.
Thank you so much for organizing this and for giving me the opportunity. But I would first of all would like to thank all the panelists for really excellent section. I have learned so much. I've been sitting there taking note and reflecting on your intervention, and I was asked to speak about the takeaway from this section. And the takeaway from this section for me is I kind of can construct the social participation into 3 domains. So the first domain is the space, the second is tool, and the third one is the institution building. In terms of space, I could see that we are talking about 2 kinds of space, right? Invited space and claimed space. So invited space, like Nida talking about the research with the trans community, the researchers doing the research and invite the trans community to participate. And you participate wholeheartedly, and you organize the community advisory board. There's also other invited space like the CCM. We are talking about the invited space created by the government, the digital portal, the dashboard. There's the invited space by the parliament to get the input from the people. So I think these are we can say there are some invited space, either physical space or digital space. But then there's also claim space. So when there's no invited space, the community claim the space. And in the claim space, I could see that there are two kinds of claim space. The proactive claim space, like the WhatsApp group, the Zalo group, the community advisory board. If it is not being invited, you invent it, you claim it. And then there's a reactive claim space, like the protest. So it's like it's didn't plan before, but then because there's a anger, there's a discontent, there's a incident happen that people just quickly organize, react to the incident. So that is a reactive claim space, I would say. So of course this space can interchange. Sometimes the claim space become invited space. It can be positive, it can be negative, because sometimes the invited space become too comfortable, and then we lose the activism a bit, because sometimes we could see that the community representative becomes so comfortable in some invited space, and then there's a lot of compromise. So, but nevertheless, these two spaces exist, and I think we should plan to have a plan to use this space most effectively. And talking about tool, we spend a lot of time talking about digital tool, and rightly so, because we don't want to be left behind. The digital revolution have gone so quickly. In the last couple of months, the only thing people are talking about AI. Before we are talking about internet, about the messaging app, and now it's AI. So I think we should all like being updated, capacitated to be able to use these tools. However, there are more tools than just digital tools, right? We are talking about physical space, where the physical interaction, the meeting, the network are so valuable. So I think tool is more than digital tool, but now we should be able to have a competency to use all the tools that are available, because if we don't want to become if we are not the chess player, we be the chess for other people to play. The third area that I learned from today is also about institution building. And by institution building, I could hear two things. One is a community system strengthening. So I mean, the tool can only be as good as the people who use the tool, right? So we can only be effectively use the digital tool and other tool if we are capacitated, if we are organized. The community representatives sitting in certain council or committee or board can only be effective and impactful if behind her or him there's a system, there's a network, there's the people who provide information, taking feedback and reflecting on. So community system strengthening have to be a very crucial part of the institution building. And the second part of it, and Gabrielle addressed that again and again, is about mechanism, about policy response loop. So community have information, community have demand, community know what they want and what works, but the mechanism to give feedback, to dialogue, to interact, to negotiate is really important. This afternoon, we have a discussion about realist assessment and realist review. And in that review, we see how important the mechanism is in ensure the social participation. So again, institutional building should have both community system strengthening, and then mechanism for interaction, for negotiation and dialogue, including the policy response loop. So, so these are my takes away, my learning, and I am grateful for all the panelists this afternoon that give me this teaching. I just want to say a big thank you to all of you and to everybody, and I am sure that we can just to say to be continued. It is not the end. We are in this journey together, and I'm sure that there be a lot more to be done to get to the social, to have a meaningful social participation everywhere in the world, so that we can get to USC. If it's not 2030, then it's close to 2030. Thank you very much. Yeah.
Thanks, Juan. With that, I'd just like to do a quick vote of thanks. Big thanks to all our panelists, both online and offline. Thank you to all our guests. And a bigger thank you to also the TGI team for all the hard work that they've put together behind this. Our offices, our design, legal, travel, IT, and admin who pulled all the stops. I would also like to extend a big thank you to the Sphere, SUNWAI, Patang, and the Communities of Solution team. Also, a big thank you to the wonderful hotel staff here who helped us with literally everything, for their hospitality and also the photographs. Thank you so much for that. Special thanks to Amit, Riha, Akshay, Nina, Paramita, and Charu for their extra heavy lift, which we very much required. And with that, thank you once again to everyone who took out the time to attend the event here. And if I could just request everyone to just gather for a quick photograph along with our panelists who are online, and we can then wrap up for the day. Thank you so much.